One of the key symptoms of eosinophilic esophagitis is called dysphagia. Dysphagia is a very broad medical term that means difficulty swallowing and can be caused by many different things. Patients with EOE have a very specific type of dysphagia that they may describe as a noticeable sensation and awareness of food traveling slowly down the esophagus. This may or may not be associated with a sensation of food sticking. The FLUTE study is interested in demonstrating whether the study drug, APT-1011, can reduce the number of dysphagia episodes that are experienced by patients with EOE. A patient with EOE typically has had the condition for many years. As such, patients can become used to the sensation of being aware of food traveling down the esophagus. In many cases, patients adapt their eating in order to avoid these sensations. For example, drinking large amounts of water or only eating foods that are known to travel smoothly down the esophagus. Patients may also avoid things like dry meats or crusty bread. Many patients find that they must chew their food more and eat much more slowly and carefully than before they had EOE. After many years, these abnormal sensations and changes to eating behavior can eventually feel like they are normal and unremarkable, but they are not. Feeling these sensations during the course of a typical meal would be considered an episode of dysphagia. In the FLUTE study, you will be asked to record every episode of dysphagia, this abnormal sensation and awareness of food traveling slowly down or sticking in your esophagus during the course of the study. You will be given an electronic diary to record episodes of dysphagia. For the FLUTE study, we ask that you record every abnormal sensation of food traveling down the esophagus. Remember, these could be sensations and an awareness of swallowing that you may have been feeling for many years, and that you consider normal. If you feel these abnormal sensations at breakfast, that would count as one episode. If you feel these abnormal sensations again at lunch, that would count as another episode. The same thing applies for dinner or for any snack that you may eat during the day. You will be trained in how to record these episodes in the electronic diary. The process for recording an episode takes less than 1 minute. There will also be a daily set of questions that are meant to remind you of episodes that you may have missed recording. You can set up your diary to ask these questions at a time during the evening that's most convenient for you. If you have any questions about your symptoms, please reach out to your physician study coordinator. Thank you for your help in participating in this study, which we hope will be a first step in having a new and effective medication available to treat EOE.